Welcome everybody to today's edition of The Bow. So today we're talking about pharmacists and nurses. This is a follow-up to an edition of The Bow in 2022 where we talked about injections or tablets. Stay tuned.
Good evening, everyone. My name is Miracle Chinoye and I'm a registered nurse under the Nursing and Midwifery Council of Nigeria. I've been practicing for the past 3 years. I'm going to tell you about my role as a nurse. First of all, we help educate patients on current conditions. We also advocate, we assess patients, and we also administer medications such as your injections, your tablets, and lots more. And I really want to clear something about the misconception about people tending to run to nurses first as their first contacts instead of going to the doctors or the pharmacists. See, I'm going to tell you a clear difference and reason why we are nurses and we are not doctors. First of all, as a medical personnel, you need to see the doctor first so as to explain why the doctor takes you to the pharmacist. What the pharmacist does is to read you the prescription, administer the prescriptions to you, the right routes, the right dose, and the right medications to you before coming down to me, which is the nurse, to administer and give you clearer information about your current health conditions. Thank you.
Hi, my name is Wong and I am a pharmacist. I've been practicing for 2 years now. I know you might be thinking who is a pharmacist or what exactly a pharmacist do. So basically a pharmacist is one that attends to the medication need of a patient or a client. So anything that has to do with medication, you get to look at the pharmacist, from production to dispensing to identifying medication errors and correcting them. These are the rules of a pharmacist. So you get to find us in the hospital, in the community, in the industrial setting, because of course our responsibility is the drug and the patient. Most of the time we notice that people, when they have medication need, they don't tend to run to the pharmacist. They usually would want to prescribe their own medication by themselves, get it by themselves, and take it by themselves. And they don't really know how to take the drug properly, why they should be taking the drug, and how to use these drugs. Oftentimes someone would have a medication problem, and the first thing he might want to do is to just use a drug that they noticed someone used before and felt it worked for them. Or maybe they want to run to a nurse to just give them an injection. And maybe the first to-go person is the doctor you need to see. And he prescribes, he diagnoses you, prescribe what drugs you need. And the next bus stop should be the pharmacist, who tends to look at your medication needs, see if this medication prescribed is appropriate for you, because medications are individualized. It's not a general or one-off thing. We look at you, we look at your history and see if this medication suits you, and then we dispense. But oftentimes most people jump this hierarchy and then just either treat themselves or go to the nurses to help administration, and this is very wrong. For the community setting, it's always said that the pharmacy is the first point of communication for the client. So I would advise that whenever you have a medication need, especially when it's not an emergency, especially when it's not beyond the pharmacist, always try to see your pharmacist. They would help you ensure that you're taking your medication the right way, help you ensure that it doesn't interact with your food, with other medications or herbs if you're taking one, and then you'll be able to get the right treatment outcome. Thank you.